My name is Carter Holm, and I am the son of our late prairie doctor, Dr. Richard Holm. And I am here today at the Avera McKennan Rehab Center in the Prairie Center, and I'm happy to be sharing a little bit of my nursing world with the viewers of On Call. So, welcome. First, I was just curious if you would tell us a little bit about how long we've been doing rehabilitation and our level of accreditation here at Avera.
Very good. Thanks, Carter. Welcome, everyone, to the Inpatient Rehab Unit at Avera McKennan. We've been a unit since 1984. We're a general rehab unit. That just means we take all kinds of patients for people with acquired disability or who have chronic diseases. Our job is to work with them and their families to get them home. Typically, the patients who come to the rehab unit have had strokes. Maybe they have spinal cord injuries. They're paralyzed from the neck down or the waist down. Maybe they've had a leg amputated. Maybe they've had trauma. Or maybe they've had a traumatic brain injury specifically. And then we work closely with the physical therapists who are working on making sure they get on their feet. And they're in this beautiful gym at least 3 hours a day to be able to work on that mobility. The occupational therapists will work with us as well to make sure that they're able to feed themselves. Maybe they have trouble getting dressed. Maybe they're not able to take a shower or even brush their teeth. So sometimes we work with very basic kinds of skills before they're able to move into more complex just activities of daily living and get home. People with traumatic brain injuries often have memory loss. They have a difficulty with communicating their needs, and so speech therapists help them just reconnect some of those lost connections in their brains so they can communicate and work on their thought processes. A social worker is assigned to everyone, and those transitions to home can be very difficult for people with traumatic brain injury. Sometimes they have behavioral needs, and they need services even after they leave the rehab unit.
Why is the variance between traumatic brain injuries so different? Why do we have a patient who is maybe here for 6 days versus a patient who can be here for several months?
That's a great question, Carter. I don't think any of us knows how people can recover more quickly than others. We know that they go in a very specific sequence in their recovery.